Hi, Dr. Dela Cruz here. I just wanted to go through a case that presented to me yesterday. This is a kind of common theme that I see all the time, unfortunately. So, there is a common misconception that if it's your back teeth, it doesn't matter, mainly because it's out of view. But I will venture to say that that is false because it does matter. And in this case, I wanted to kind of share this with you. This is a 73-year-old female. It had been a few years since she's been to the dentist. She's had several health issues, and she's just unfortunately kind of neglected her teeth in the last several years. She did admit to having seen her dentist in the past and have had some treatment in the past, but she's also had several teeth removed in the past. And in her mind, as long as you couldn't see it, it didn't matter. And this is a classic case of that. So I wanted to kind of present this first. So the most important teeth, at least in my personal opinion, is the 6-year molar, which sits right here and right here. Unfortunately, your 6-year molar are the most commonly removed, extracted, filled, or crowned. And if money is an issue, most people that I see will opt to just have it removed. So I've seen young adults as young as in their early 20s have problems with these, even teenagers. And if they cannot afford the treatment to fix the tooth, they typically will opt to have the tooth removed. And the most common thing they tell me is that since you can't see it, I would rather just have it removed. Even though I go through the spiel of like, here's the reason why you don't want to do this, and this is what I'm going to share with you. But I want people to kind of understand where we're coming from as dentists and why we recommend saving these teeth. At least for me, the four corners of the teeth or the four molars that is the most important to me is the 6-year molar. Mainly because their primary job is to provide support, and second to that is their chewing. They contribute to a huge percentage of your chewing function, up to 80%, and then your 2nd-year molar contributes to about 20% of your chewing, and usually wisdom teeth contribute to less than 1% of your chewing. You have some other teeth that help in chewing, these premolars right here, but that's not their primary job. And as you can tell in this, that this premolar is about half the size of a molar. And typically, your premolar is a single rooted tooth, versus your molar can have 2 or 3 roots, especially in the maxillary. There's typically 3 roots, and in the molar or in the mandibular section, there's 2 roots. Okay. And the reason they're important is the first one is malocclusion. So when you, at least in dentistry sake, when we say malocclusion, meaning that your bite is not quite perfect, okay? And that can lead to several problems. The big one is tooth movement. So I want to highlight here, as you can tell, the molar should be in this position right here. If I was to measure this molar, it's about 10.35 millimeters. And this is the 12-year molar. If I was to put a regular size molar, right here is about 11.5 millimeters. But what's happened is that this space has been taken up by this tooth. So the molar that's normally here would go to about right here. So in this patient's case, this molar has kind of, rather than being upright, it's tilted this way, and it's closed up that space. For some people that doesn't cause a problem, but there are for some that does cause a problem, mainly because it creates a trap under here where food will get stuck, and it's really hard to kind of clean there. So it also causes that issue. Okay. The other, or the big thing in my personal opinion, is that it causes tooth wear. Okay. Specifically in this patient who's missing the 6-year molar, and up here she's missing the 12-year molar. On this side, she has a failing bridge here, a 12-year molar that's what we call super erupted, but the actual, what we call plane of occlusion, where the teeth should line up, should go from about here to here. As you can tell, this tooth is way above that. Okay, and so this is what we call super eruption. So since there's no tooth opposing this tooth, the tooth is kind of migrated up. And as you can tell, these are missing there. It's 6-year molar. In fact, she's actually missing her second premolar, her 6-year molar, her 12-year molar. It looks like there is no wisdom teeth there. So without having support on this side and without having support on the other side, most of the beating or the wear that's occurring is in the premolar to premolar section, this section. Okay. If I look closely at her teeth, this right here is your canine, and typically they have a point. So I'm just going to kind of draw here and give you an idea where this point should start. So the point should go about here to about right here. Okay, don't mind the numbers here. This is what it should look like. And the problem with that is it's flat. And the reason it's flat is there's no molars to stop you from kind of biting down and rubbing your teeth together, like putting rocks together. So over time, this patient has kind of been biting down and using her front teeth for not only chewing, but there are other signs in here that indicate that she may also have some either sleep apnea or sleep obstruction, which I will kind of go into in another video. If this occurs long period, the teeth tend to wear and chip. If I was to venture to guess, these two front teeth are actually supposed to be about this long. As you can tell, there is wear on these front teeth. So where the line of these actual teeth are compared to where it should be will give you an idea of how much she's worn, and not just the front teeth, but also these lower teeth. Another indication to that is if you zoom in closely, see how they're kind of cupped out. It should be a nice smooth transition to that. I mean, it should be kind of dome shaped, okay? But in her case, it's not. And again, the canine, he is very, very flat, okay? And so she's actually worn through her enamel. So this is her lower front tooth. It's right here. This white color right here is called your enamel. And underneath that, this grayish color is called your dentin. So the tip of this tooth should be kind of right here. And as she's worn this down, she's getting into the dentin. For some people, this will lead into more sensitivity or with your teeth just in general. But as you wear it down, dentin is not as resistant to cavities. So you can actually form cavities in these areas and cause major issues. But going back to these missing molars, by having missing molars here for years, her bite has kind of gotten worn down. Here's another example. Because she's only hitting these areas, if I was to kind of rotate this, zoom in, right here in this section, she has worn through this tooth and actually worn half of this tooth off. Now she's already into the dentin, into the root surface. This to me is no longer restorable, especially when the root is only from here to here. There's not a whole lot left to this tooth. Okay, so there are multiple things that's occurring here, but I'm kind of just focusing on the molars, the missing molars. So by having missing molars, not as only is her teeth collapse, but when she bites down, so right now in this x-ray, her bite is open because they're instructed to do so. But if she's actually biting down, this, what we call plane of occlusion, is sitting right about here. So this is the level of her bone, and where her molars and this one is actually sitting right about here. So the space, very little space. So even if we could place an implant in this area up here, the tooth would be very, very, very short. With having such a collapsed bite, it possesses a lot of problems in this area. And the wear on these teeth. So at this point, I'm going to go through this case with Dr. Murray and get his opinion. But this is a very complex case to restore because it's not as simple as just replacing some of these teeth or putting partials in here. Because although partials do help to kind of replace these teeth, the partial is going to be very, very short. And partials are made out of metal and acrylic or plastic teeth. They wear down, so they don't give you the support that is designed to kind of stop you from exerting a lot of force on your front teeth. And so a partial is not even a good long-term option for her, because one, it's short, two, it'll wear, and the damage on the front teeth will continue to occur. So there are several issues that occur with missing teeth, and I will probably create a video at some point in the future and kind of follow up with this case depending on what she chooses for treatment. But just wanted to kind of put it out there for those who are considering removing their molars in the back. They are so very, very important. Please take the time to really consider before you make the decision to remove these teeth. Really ask your dentist or your healthcare provider, what are the issues that can occur if I remove these teeth, because they are there for a reason. And if you do save them early in life, it will protect your front teeth, which will lead to less dental cost and obviously tooth loss. So please do take the time to talk to your dentist and ask them, what are the potential issues with this and what you can do to replace them. Thank you.